we are going to go through the answers as well as the key terms and what to look up in the index. Remember, when we are trying to locate a code, we're going to go to our index first and then check in our tabular. The thing that's different about CPT versus ICD-10 when you're looking up your codes, in CPT you're going to see a lot of times it's going to give you a range of codes, or it'll give you more than one code, so you're just going to have to check, if it gives you a range, you'll have to check that in the tabular. So for the first one, these are the terms that I highlighted, and then we'll go through what you would need to look up in the index. So venipuncture is your first one. We know from the lecture that we have to have a code for the blood draw, and in this instance, it would be the venipuncture, and then you would look up routine, because this is a routine part of a lab exam. And then comprehensive metabolic panel. In this instance, you're going to pick the panel to look up. Complete blood count, you can actually use that. Look in your index for complete blood count. It's actually going to route you to complete blood cell count, and then it'll give you the CPT code for that. And then this is going to be your last term that you'll look up in the index, and this is actually going to give you a range of codes. So when you go to that range, this is where the IGA will come in place, and it'll determine what code you actually will pick for that one. The next scenario, the same thing. There was a venipuncture done. Also a lipid panel. So the same thing with the panel, you're going to look for panel, and then there's going to be a specific term for lipid. So you can check those both in your tabulars. The next one, the thing I want to point out here is a little bit different from above, is we don't have the 36415 code, because I specifically am asking what the lab would bill for. So the lab, since the patient's blood was drawn in the office and then the labs were sent out to another facility, I'm asking the other facility that's analyzing the blood what CPT codes would they use. And so that is your estradiol and the follicle stimulating hormone. So in your index, you want to look up this as your term, and then you'll look up this one, follicle stimulating hormone, as your term, and that will give you your two CPT codes. The next example, again, the patient received got his blood drawn, and they were trying to measure the clotting. So in this scenario, for the prothrombin, you're going to look up in your index, you're going to look up this term. And then it's going to give your CPT code, and then you'll check in your tabular. So the next scenarios, we're actually going to be looking at radiology exams. So the first example is the screening bilateral mammogram with the tomosynthesis. So in my index, I'm going to look up the term mammography, and then you're going to see the term where it says screening mammography, and then you're going to see the tomosynthesis right under that. So you're going to have actually two codes for this scenario, one for the mammogram and then one for the tomosynthesis. So that's where you get these two codes. The first one is a CT shoulder left without contrast. So this is a copy of the radiology report. So what we want to do in our index is look up the term CT scan, and then we're going to go all the way down until we see without contrast. And there's not a specific one for the shoulder. The most specific it has is arm. So we're going to choose arm and then check that 73200 in our tabular. The next one is X-ray chest, 2 views. So on this one, you're going to go X-ray and then chest. It's actually going to give you a range between 71045 and 71048. So when you look at that range, you will find in your tabular, you will find the appropriate code is 71046. The next example is going to be a pathology example. And so on this one, we're trying to figure out what the CPT code for the gross and microscopic examination of the colonoscopy would be. So in this case, you are going to go to surgical pathology, because this was a pathology that was taken during the colonoscopy, or excuse me, a biopsy taken during the surgery. So you're going to go to the subterm of gross and micro exam. Because it's only listing levels in your index, you're going to want to open to just, if you open up to level 2, it's going to take me down to, it's going to give me the anatomy. So what I'm going to look for is I'm actually going to look for the level of where the biopsy was taken from. So I am looking for a colon biopsy, and I can see that in my tabular 88305 includes the colon biopsy. The next ones are example of HCPCS, and then we do have a radiology example in here. So again, I've highlighted the key terms. You're going to want to look in your CPT codebook for MRI, and you'll do with contrast, and it's of the brain. So that's going to give you your 70552. And then in your HCPCS book, you're going to look up contrast, and there's going to be a specific one for MRI, and that's going to give you your HCPCS code. The next example is the lightweight wheelchair. So you're going to look up the wheelchair in your HCPCS2 book in the index, and then there's going to be a subterm for lightweight, and that's going to give you your HCPCS2 code book. The next one is actually from the HCPCS2, and it is from your table of drugs, which is listed alphabetically ordered. The administration method was done via IV. But if you look up the table of drugs and look up Fludera and then 50 milligrams, it's going to give you the HCPCS code of J9185. And then the last thing is the HCPCS2 code assignment for the tracheostomy filter. You're going to look up tracheostomy in the index in your HCPCS2 book, and then there should be one that's specific to filter. So that's 84481. Great job.